Hi, my name is Karim Abdallah. I'm one of the gynecology consultants based at Sheffield Teaching Hospitals. There are around 8,000 women in the UK who are offered a hysterectomy every year. And there are various indications for offering a hysterectomy to a woman. The most common indications are heavy periods and painful periods. Conditions such as endometriosis and adenomyosis are often common reasons for offering a hysterectomy. There are other reasons, of course, things such as fibroids or a prolapse can be also treated by a hysterectomy, and that's, of course, in addition to cancerous and precancerous conditions. A hysterectomy is a major surgery, and the hysterectomy can be different types. There is, of course, a total hysterectomy, in which case the uterus is removed along with the neck of the womb, which is the cervix. Um, Removing the fallopian tubes is also usually recommended to do at the time of a hysterectomy. However, that's not entirely the case with the ovaries. Recommendations about removing the ovary or conserving the ovaries will depend on multiple factors and usually the indication of the hysterectomy itself. A laparoscopic hysterectomy is a major surgical technique, which is usually minimally invasive. This is performed through small cuts on the abdominal wall, usually known as keyholes. A camera, which in other terms is the laparoscope, that is introduced through one of those small holes. And this will be followed by the introduction of small instruments to perform the hysterectomy through the remainder of those small cuts. The uterus is usually removed through the vagina. Candidates for a laparoscopic hysterectomy are usually women who present with heavy periods or painful periods. Conditions such as endometriosis and adenomyosis are common reasons for offering hysterectomy. Of course, a hysterectomy, being a major surgery, will be offered following failure of medical options to control patient symptoms. One of the candidates to be a candidate for a laparoscopic hysterectomy will also depend if your family is complete or if retaining fertility is a concern. A laparoscopic hysterectomy can take somewhere between an hour and up to 3 hours. This, of course, will depend on the individual conditions, the surgical risks, and the medical condition of the patient. Of course, this will be in addition to the complexity of the surgery itself. A laparoscopic hysterectomy may not be an option, depending again on the individual circumstances of the patient. A patient who is wishing to retain fertility, obviously a hysterectomy is not an option for her. However, on the surgical side of things, a laparoscopic hysterectomy may not be an option if the uterus is of a large size. And also in the presence of multiple surgical interventions in the past, a laparoscopic hysterectomy may not be the safest approach.